Good afternoon, I'm Scott Schaefer, and I call the February meeting of the Minneapolis Housing Advisory Committee to order. Can we take a roll call?
Yes. Karina Bowler.
She just told me she's gonna jump on in a few minutes.
Okay, sounds good. Bruce Brunner. Colleen Ebinger.
Here, sorry, I was on and off mute.
No problem. Chloe Jackson. Spolinski J. Cox. Queen Kimmins.
Present.
Charlotte Kinsley.
Here.
Aliana Letran Garcia. David McGee. Lisa Mears. Melissa Newman. Colleen O'Connor Toberman.
Here.
Maggie Addy.
Here.
Scott Schaefer.
Here.
Janine Seja.
Here.
Russell Smith.
Here.
Rose Tang.
Here.
Annie Wells.
Here.
Okay, saw a few more, but I'll just go through everyone else. Karina Bowler.
Here, I'm here.
Bruce Brunner.
Here. Can you hear me?
Yep. Yep,
Okay,
I
thanks.
heard you, Bruce. Thank you. Chloe Jackson. Spolinski J. Cox.
I'm trying to.
Aliana Letran Garcia.
I just have to mute it. So
David
just gotta give me a
McGee.
second.
Lisa Mears. Melissa Newman. There are 12 members present.
All right, do we have a motion to adopt the agenda?
So moved. This is Colleen O'Connor Toberman. Colleen Ebinger,
Colleen.
second.
All right, so Colleen's moving and seconding. Can we take the roll call?
Yes. Karina Bowler.
Yes.
Bruce Brunner.
Yes.
Colleen Ebinger.
Yes.
Queen Kimmins.
Yes.
Charlotte Kinsley.
Yes.
Colleen O'Connor Toberman.
There we go. Yes.
Maggie Addy.
Yes.
Scott Schaefer.
Yes.
Janine Seja.
Yes.
Russell Smith.
Yes.
Rose Tang.
Yes.
Annie Wells.
Yes.
There are 12 ayes.
All right, with 12 ayes, the agenda is adopted. Do we have a motion to approve the minutes of the January meeting?
This is Charlotte. I make a motion to approve.
Thanks, Charlotte. Is there a second?
This is Bruce. I second.
Karina, I'll second. Got it.
Okay, I think I heard Bruce second. Can we take a roll call on the adoption of the minutes? Approval of the minutes.
Yes. Karina Bowler.
Yes.
Brunner.
Yes.
Colleen Ebinger.
Yes.
And Chloe Jackson, did you just join the meeting?
Yes.
Hi, Chloe. I'll mark you present, and then we're voting right now on a motion to approve the minutes of the January meeting. Would you like to vote on that?
No, I want to recuse myself from that.
Okay. Queen Kimmons,
Yes.
Charlotte Kinsley,
Yes.
Colleen O'Connor Toberman,
Yes.
Maggie Addy,
Actually, I have a correction. I'm listed as being present at the last meeting and I was not actually there in the minutes. So with that correction, yes.
thanks. I think maybe Katie is here taking minutes. Maybe you can make that correction. Make a note of that.
Do we need a motion to correct that? Can we just do it? I would make a motion to correct the minutes. Do we need that? Or not?
I don't.
You can ask without objection.
Okay,
Just say without objection, unless anybody objects, just universal adopt it.
Sounds good to me.
All right. So just go ahead and continue with this vote.
Unless somebody objects.
Okay. All right. That sounds good. So we'll make sure that's noted as part of these minutes for this month's meeting. Thanks, Maggie. So Scott Schaefer.
Yes.
Janine Seja.
Yes.
Cecil Smith.
Yes.
Hang.
Yes.
Wells.
yes.
And then I believe Spolinski Jaycox, did you join did you join the meeting?
Yes, I did.
Great, welcome. We were just voting on a motion to adopt the minutes of the January meeting with an amendment. The previous,
Maggie.
yeah, about Maggie. Would you like to vote on that motion?
Sure. Yes.
So since we had some people join late, we can just mark them as here, or do they have to say aye or anything, right, Katie, Topinga? We could just,
Yeah, I think we can just mark them as here.
okay, thanks.
All right, there are 13 ayes on the motion to adopt the minutes with that correction.
All right, the minutes are approved. Before we move on to the public comment period, I should briefly address an issue that's been weighing on many of us. Last week, Amir Law was killed by Minneapolis police. I don't know what would make this right, and I don't know what would prevent this from happening again, but I do know that housing is connected to all aspects of life. And everyone motivated by us to make Minneapolis. So I'd like to take a moment for us to recognize that Amir Locke's life mattered, and to reflect on our responsibility to guide the city toward fairness. Queen, did you have anything that you'd like to say?
I just want to say that that this is not just a warrant issue, but a housing issue. When someone comes in your home or anyone's home and a life is taken, I think that affects all of us. And I would kind of open up the floor to anybody who has anything that they want to say that's pressing for them. I know that in North Minneapolis, there are a lot of us who are still grieving the loss of Mr. Floyd's life and the young man, Dante Wright. And so now here we go again with Mr. Amir Locke. I just wanted to open up the floor for other people who may have any suggestions or comments that they would like to state at this time.
Thank you for that, Queen. This is committee member Karina. I would just like for us right now to take 22 seconds of silence in honor of Hamir and his family. So if you guys could so do that right now for 22 seconds. Thank you, guys.
Hi, this is Spelinski. I just kind of want to piggyback on what both Queena and the other committee members said. I think it even goes beyond the no-knock warrant, and I as well is friends with Amir's mother and knew Amir very well. But I think, unfortunately, property management isn't trained a lot of times because I had a situation where the police had a warrant for some particular person who did not live in my home, but yet the property management company opened the door unbeknownst to me and let them go through my house. And I called them on it because I know you can't do that, specifically because the person didn't live there and it was the wrong place. But I think it even goes beyond the no-knock warrant. It's just a warrant in general, and it's an educational piece for property management as well.
Thanks, Linsky. Does anyone else have anything to add?
I would say enough been enough. Our people are, tired of this killing, the assassinations to our community of people. It's so much trauma that's being put on the Black community right now. And enough of, of the, gaslighting and all of the, hiding the hands and all of that stuff. We're tired. We're being tired. We're tired in housing. We're tired in, our children and our families being taken from our homes. It's crazy. I was just watching the press conference just now at the Capitol, and they were talking about, how the raids happen at night, while most people are sleeping or eating or whatever. But we're not talking about this unjust system that's systematically even taking our children with child protection. That's happening at night to families. They coming in the home with the police and taking our children, adding more trauma to our families. And, it's just, this system is broken. It's broken on our barriers. And we're on this housing committee to help housing. But a lot of people that's fighting the fight are, being racially profiled, by people who don't want them in them houses. So, but it has to stop. We've been tired. We're tired of talking about this. We're tired of coming to these platforms speaking about what's happening to us. Like, what have we done so bad to make people hate us? What do we do? It's a person on this call that's a member of this committee. I won't say your name, but I want you to know that I truly appreciate our friendship, and I appreciated what you've done for me doing the George Floyd uprest stuff. And I just want to tell you that. And I know you know, and I just want you to know that. But for the others who just turn the other cheek and don't do much for our people, it's hurting us. And your voice can help us by talking to legislation, by changing these laws, by getting them to rewrite history. But we're tired. We're tired of seeing this on the news. So I'll sit back and let somebody else speak.
Oh, there he is, the mayor.
Queen, I'm happy to jump in, but I wanted to make sure others got an opportunity to speak. Well, in that case, I'll touch briefly here. I just came in a couple of minutes ago, but I'm fairly confident that the discussion centers around the tragic death of Amir Locke. We all need to do better. I need to do better. The policies need to be better. The practices need to be improved. And it shouldn't take tragic death to further push us to revise. And, you know, it's hindsight is always 2020. And I'll tell you, these policies will continuously evolve throughout time. But it's on us to dig in right now to make sure that we get this right with the overarching goal of preservation and sanctity of life, of safety for people who are involved. And we just can't keep cycling through this. Yeah, I like to tell you that there's one single easy answer for all of these solutions, whether it's around reform or housing or economic inclusion. There's not. As was correctly pointed out, it is societal, it is systemic, and it's on us to change the systems. And you all are part of that, and that's the work that you're doing right now through your involvement in this advisory committee on housing. I mean, affordable housing, I have always believed and continue to believe is that foundation from which people can rise. I mean, it is an inherent good, it is an inherent right. And that will always be a focus for mine, for personally, but also for our cities. And something that I really do appreciate about this group is that you do come from a number of different perspectives, of lived experiences, and sometimes you've got totally different opinions as to how best to address some of these critical issues. And I mean, having that deliberate approach and having that willingness to talk about the issues, to even argue about them, I think it ultimately gets us to a better understanding and better work. But you've all ultimately come to this work to engage together because you've got a belief that all our neighbors should have safe, stable, and affordable housing. And I know you've got a full agenda here of updates. I understand it's a emergency rental assistance, it's healthy homes and eliminating childhood lead poisoning. By the way, that's a big one and something that I think we can solve. It's homelessness response, it's rent stabilization, all these things. So I won't go too far into the weeds this afternoon, but I really wanted to just say how proud of the work that I am, how proud of your work I am. And how proud of the work that we can do and have done together over these last several years. And that's to increase the production of affordable housing, to improve the homelessness response system, to increase opportunity in affordable home ownership. That's to better ensure rental protections. It's a lot of work. Is it enough? The answer is no. You know, people always say, well, we still have issues, and they're right. We do still have issues. And I think, you know, we need to be at a place where we can recognize the positives that are occurring and also recognize that it's not enough. It's not enough. We can make progress and also recognize that that progress falls short. And so we got to just keep working at it. And I know you are. It's been 4 years right now of dramatically increased investment towards those ends. We plan to continue some really substantial investment and a focus on that housing affordability into this term as well. I look forward to the continued engagement and input for these next 4 years. And I know that particularly at a time like this, you know, oftentimes it feels hopeless. It's not. We can do it. Is it going to be easy? No, it won't. But, you know, when you have a whole lot of people that care and are compassionate, that are locking arms to get this right, you know, we will keep moving things in the right direction. I just want to thank you for your work and your participation, and we will do everything we can to partner with you. Thank you.
Thanks, Mayor Fry. Do you have any time to take any questions from committee members?
I do. At least,
Okay.
let me check.
Are there any committee members who have any? Okay.
I believe I do. Go for it.
Do any committee members have any questions for the mayor?
Seeing that they're
This is-
silent, I will take first bids at that. So, Mayor, I adore your leadership. I've been knowing you a long time. I just want to know, when it comes to being able to help individuals with these high rent increase, can we look forward to your office or from this body of work that I reside with? Can we look forward to getting some sort of rental vouchers or rental assistance where people, it can offset some of the high cost of the rent in the cities, Hennepin County or just the city of Minneapolis? Thank you.
Queen, it's good to see you. It's been too long. Yes, you know, we have, as you know, put forward, whether you want to call them vouchers or rental assistance or direct subsidy for people that need assistance in housing. We have done that through multiple phases of emergency relief that we've gotten through the pandemic and since then. You can also count on us to work more. I mean, when you talk about vouchers, Section 8 or otherwise, I mean, I think you know this, but it's been dramatically underfunded probably since the 80s. Both Democrat and Republican presidents, both Democrat and Republican legislators are at fault. We're all at fault. Look, it's on all of us, but it has been dramatically underfunded for a long time. And I do feel that that's one of the most immediate and direct ways of helping people that are experiencing severe housing instability is by getting them money so that they can do that work. We do have that programs in place that give those direct allocations through, for instance, Stable Homes, Stable Schools. That has helped around 3,000, I think 200 now, or 3,300 children in our MPS system. And we've got some direct relief as well that I know that our city and counties are helping to allocate in that emergency rental assistance. We need to do more, and especially as some of these dollars are running out, it's going to become even more of an obvious concern. And so we want to partner with all of you to get the job done. I'm not going to lie to you and tell you that we're going to have, after these funds go out, that the city is going to be able to step up to the tune of, you know, tens of millions of dollars or hundreds of millions of dollars to solve the issue. I'm not someone that's going to overpromise like that, but you know, but I do see some momentum around getting this necessary assistance done.
Thank you.
Thank you.
I would jump in. Hello, Mayor Fry. This is Karina.
Hi, Karina.
Hey, how are you? So I would jump in by stating, you know, the federal government, you know, around housing. The federal fair housing has never had any enforcement, and we just want to make sure that everybody has housing. But in our community, we need to make sure that we also protect the housing that's there, you know, and I'm talking about gentrification. Places like Detroit, Baltimore, Gary, Indiana almost look like abandoned states. You know, the racial disparities in those states are disgusting to even look at. Watch documentaries and watch people talk about it just to say they've been on this platform. Our community in housing, where we are, you know, lacking in affordable housing, and our communities that we're being pushed out of, we need some real help by making sure that we can get people housed and that families are not being pushed out, you know, because we're being priced out. As for housing for all, housing was written to provide housing for everybody, but the civil liberties and injustices that we are all facing from local government has taken a backseat on our cry. Everybody knows my story, where I stay, and the housing injustices that I'm still facing. To take a backseat on that, our civil and human rights has been, just nothing happened. So I want to make sure that, we're living up to what we're saying we do. I follow this lady on YouTube, and her and her son are slowly dying because of the mold, the infestations, the asbestos that's growing in her public housing building. This lady been on YouTube for a long time, and she looks terrible. And I don't want it to come to where this lady died telling her story because no one's listening to her. She's in New Jersey, and her public officials are not listening to her. They won't even come out to her building. She's speaking for a whole, I think it's 2 big buildings, but she's speaking for a whole community. She's carrying everybody on her back. And all I could do is comment because I don't have a way to reach out to her. I don't have a way to help her, talk to her. But she's doing the same work that so many other renters in Minneapolis is doing, and that's a death sentence. That's like putting a bullet in the gun and shooting us Black women or Black community members or whoever that's fighting a fight to try to help solve this housing crisis. We can't continue to keep putting people in office when they're not listening to us. They get in the office and they change their agenda. We want people who's listening and it's going to do the right thing and follow the Constitution and follow what you say you're going to do. And I'm not talking just you. I'm saying anybody. But we need to make sure that somebody is listening and they're doing the work for families and women and children, elders, and everybody in real time. Because these stories are out here and they're not making them up. But we have to start holding these landlords accountable. We got to start holding the system accountable. We even got to hold the federal government accountable, property management, and everybody. Because these stories are detrimental to our lives and it's a death sentence. Y'all playing Russian roulette with people's lives, and enough been enough. So I'll leave it at that, and thank you for being on this call today.
Karina, thank you, and I'm just going to let your words sit. I'm happy to respond if there are questions you have, but your strong words I think are accurate, and thank you for holding us all accountable.
Thank you.
Yeah. I'll also just briefly note that in addition to the programs that I mentioned, we've also got a guaranteed basic income pilot that we're rolling out, recognizing that people really know best how to utilize limited funds. And so it's not enough. We're just talking about a couple hundred families, but that pilot could hopefully lead to more. And the results of that pilot could be a really good and strong argument to then expanding it going forward. So it's the Bring It Home project that and campaign that Beacon is running that I think we all need to be part of and lean into in a big way. And there are efforts that are happening. We just need to keep going. Happy to answer any other questions.
And to answer to that guaranteed income, okay, that's a great idea. I think it's good, that people are helping the public. But you got to think about the people who it would affect. So if you're giving that to people who live in public housing or who's getting government assistance, Social Security, but they also work, that's going to still affect them because that income now is going to change their income where their rent goes right back up. So we have to think about that. I know in Atlanta and other places, they're giving the residents cash. I don't know if that cash is counted, if the public, wherever they're receiving the funds are asking them, have they received that money? Considering that it is still considered cash, but it's a good gesture, but we don't want to continue to put people right back in the same situation that they were trying to get out of.
Okay.
And yeah.
It's a good point. It's a very good point.
All right, well, I don't see any other hands raised, so wanted to thank Mayor Fry for stopping by and sharing information with us, and we look forward to working with you in your office on advancing safe and healthy and affordable housing for all Minneapolis.
Thank you, everyone. Really appreciate your work. We'll talk to you soon.
Thank you.
Thanks. And next on our agenda is the committee's public comment opportunity. The Advisory Committee on Housing sets aside 10 minutes on each of our agendas to hear public comments from non-committee members. We ask that each person making a comment keep their remarks to 1 minute. All comments will be related to housing issues in the city of Minneapolis, and when possible, related to items on the committee's agenda for this meeting. We take notes on all public comments, and we discuss them as they relate to our other agenda items. City staff or committee leadership will follow up with any person who has made a comment if a need for a reply is identified. If anyone is present today to make a public comment, please unmute yourself by pressing *6 and state your name now. We will call on individuals to make their 1-minute comment. Is anyone here to make a public comment? Hearing no comments from the public, we can move on to our next agenda item, which is updates on rent stabilization and rental assistance from Katie and Joey.
Thank you, Scott. Hi, everyone. I will provide an update, I think, about rent assistance, and then I think we were just going to talk briefly about rent stabilization at the end of the meeting. So unless you want me to just do both at once, I don't know if that's like too much of a shift in the agenda.
If you maybe want to do both, Katie, I think there was just an issue of not being able to kind of reorder things on the agenda. So if you want to handle both, that would be great.
Okay. Yeah, they're both. It's yes, I think that makes sense. So on the rent assistance, I'm sure many of you are aware or saw the notice that the Rent Help MN portal stopped accepting new applications for the for emergency rental assistance at the end of January. And just as a reminder, I know we've had a lot of discussion about this at this committee, so I don't think we probably need too many reminders about what that is, but that was the statewide portal for COVID-19 emergency rental assistance. And the city of Minneapolis does have direct funding for COVID-19 emergency rental assistance that we received from the federal government, and the state and Hennepin County also received direct allocations of funds. The portal is managed by the state, and they closed it because they are starting to run out of money, and they didn't want to have a ton of applications that they couldn't fund. So they closed it to be able to process applications with their remaining funding. The city of Minneapolis also accepts applications through that portal. We are not accepting new applications either because we still have applications in queue that we are processing with our remaining funds. We did ask the state to transfer any incomplete applications from the city of Minneapolis to us so that we can follow up with people who have maybe started an application but didn't finish it, and to see if they need further assistance. If somebody who lives in the city of Minneapolis started an application prior to the portal closing, but didn't have a chance to finish it, they can still do that. And we will process those applications as long as we have funding available. And then we are going to be doing some targeted outreach in the coming weeks to people who had started applications and didn't finish them to let them know about that opportunity. And we are currently working on a plan for that. That is the update. It's not great news because we know there's still a ton of need. And unfortunately, the significant amount of funding that the state received from the federal government for emergency rental assistance is starting to run out. I'm happy to take questions. 211 is still, so if there are people who aren't sure what's going on with their application, they can still call 211 for assistance to get updates. Hennepin County also has a number that Hennepin County and Minneapolis residents can call that I don't have at my fingertips, but I can try to find it and get it out to everyone before this meeting is over. And then we are still working with our nonprofit housing navigator partners who are still helping people trying to finish applications that are incomplete in the system. Colleen Ebinger, so you have a question.
Yeah, I'm just gonna comment. Obviously, this is the Minneapolis Housing Advisory Committee, so we're most focused on Minneapolis, but we know people living in lots of different areas around here too. So I just want everyone to know that Ramsey County, the city of St. Paul, and Washington County do still have funds in their tenant-based rental assistance program. So if you know people there who need assistance, they can still apply in those jurisdictions.
So if there are no further questions or comments there, I can just also give the brief update on rent stabilization. And really, it's very brief, but the update is, as if anybody has been following council meetings since the new council started meeting, you may have heard that they are planning to create a work group specifically to work on recommendations for rent stabilization policy. And so right now, council leadership and the mayor's office and city staff have been having conversations about how to roll out that work group and what the scope of work will be and those kinds of things. So no details to share on that yet, but we will definitely keep this group updated. But just wanted to let you know that's what's going on there. And I don't know if Andrea Inoue is on and has anything to add to that overview, but there she is. And there's a couple questions. Yeah.
Yeah, I don't, if there are questions, I can help answer them. I think you summed it up well. The work is in progress to sort of put the parameters on around what that's going to look like, and we'll have some more information soon.
And I don't know who had their hand up first, but Scott or Queen, maybe you can call on.
I think it was Charlotte.
Okay.
Thanks, Kat. I'm wondering, this is going back to your rental assistance update, Katie, and maybe Andrea. I'm just wondering if anyone on the call can speak to what we are seeing with evictions. And I'm seeing shelter numbers go up, but there's so many different things happening that it's hard to say what's causing what. And I'm just wondering what you're seeing in terms of evictions and what you're maybe anticipating, especially given like this extra protection is gone maybe quicker than some of us had thought.
Yeah, and I see Cecil popped on, so maybe he has here too. I don't know that I have numbers other than, yeah, so we could certainly try to provide and make sure we provide an update on that for next time. And I see Andrea's putting something in the chat.
Yeah, I just put the, this is sort of some, maybe not quite the level of detail that you're looking for, but maybe it is. The evictions, this is the dashboard that is about evictions in Hennepin County. There's lots of good information there if you're interested in following that data. You can look at it either monthly or weekly. So it does sort of show the trends. It is not super, it's current, but not super current, if that makes sense. So it's through January 30th is the last week of data. So a little bit behind, but definitely you can start to see the trends up in terms of eviction filings.
Yeah, and I can add a couple of things. So we're tracking, we're watching the Hennepin County dashboard. The other dashboard we're watching is a Eviction Lab. They are tracking 16 jurisdictions very, very closely, week to week. And the data that we're seeing is, as of January, we're still 36% below average month-to-month numbers. So it hasn't even reached pre-pandemic levels. And I just completed a survey of 30,000 units earlier this morning, which included Class A, B, and C, so right across the entire spectrum of the market. Not a lot of affordable units in that sample space, but we are back at collections that are now above what they were in March of 2020. So people are paying rent now by the 6th of the month at a higher level than they were March of 2020. Which is a great sign. That's, you know, obviously there's still families that have needs and we need to get them assistance to keep them stably housed, but we're not seeing a major crisis yet. And there were some concerns because when Rent Help MN cut off, they did not take February applications. You had to have an outstanding balance to be eligible, and you were going to face denial. And they did get a lot of applications in the 20,000 applications that they got for February. And those were, you know, automatically denied. But that did not show up in the February rent collection reports from the management companies.
Thank you.
Thanks. I'll call on myself now. I just had a quick question about the rent stabilization working group. Will that be an internal working group, and will there be a way for this committee to help with that or interact with it or learn what's going on at all?
So it will be, I think, actually made up of mostly external stakeholders, and I believe so. Yes, that is certainly a recommendation we're making as staff, that there be a close tie to the work of this committee. So, so I think some of that is still to be determined, Scott. But yes, we will figure out a way to make sure that there's a connection or regular updates provided here as well.
Okay, this is Queen. I just want to say, I see your hand up, Mr. Berner, but I want to ask very quickly, will this, I'm looking for the city to do some engagement with residents about this stabilization. I'm sorry, this group that is going to be working with this other body, with the city and all that. And I'm just wondering if there will be any engagement or outreach to other residents of the city, and how, because a lot of times I hear residents say, hey, we were left out of this process. And I'm wondering if there's going to be an engagement piece that could include them. Thank you.
Thanks, Queen. And I think similarly, we don't have some of those details. We don't know some of those details yet, but we can certainly make sure we take that comment back to the policymakers who are working on determining what the structure will look like. But my guess is that there will be some engagement opportunities. There will certainly be engagement opportunities as if there is a policy being considered by the council through the public process, but my sense is there will be other engagement opportunities earlier on with this committee as well.
All right, Bruce, did you have a question?
Katie, I'd like to volunteer for that working group if you have any input or soliciting people. Thank you.
Thanks, Bruce.
All right, if there aren't any other updates or questions for Katie and Joey, Queen, did you want to take the next agenda item?
Certainly. All right, so we are going to be hearing from Lisa. Don't get mad at me. I don't know how to pronounce this correctly. Lisa and Vu Tran. And they're going to talk about healthy homes and lead hazard control. Sorry about the name. I don't know how to pronounce it that way.
That's just fine, Queen. We're going to kick it off with Vu Tran speaking about the asthma services.
Queen, I think you pronounced my name correctly and perfectly. So perfect for that. I'm going to try to share my screen and I've also emailed Tina with this PowerPoint and the flyer also for your record as well. So let me try this sharing the screen feature here. Can you all see that?
I can.
Great, yep. Great. All right. So thank you for inviting me to speak at your committee. My name is Vu Tran. I'm the asthma project coordinator with the City of Minneapolis Health Department. I've kind of new to this post, but not new to the city. With the health department, this is going on my second year. But I've been with the City of Minneapolis Regulatory Services Department in the housing unit for 24 years before this. I have a Bachelor of Science in Housing from the University of Minnesota. And then in my current role, I'm a licensed lead risk assessor with the city with the state of Minnesota. So that is a little bit about myself. There's two objectives that I'm hoping to get across. So after the presentation, I want you to gain a better understanding of the asthma programs offered through the city. And then also you'll feel comfortable referring families and friends to this program as well. So what is asthma? Asthma is a chronic lung disease. Currently, there's no cure for it. If you're born with it, it's going to be with you throughout your life. It causes the airways in our lungs to narrow and making breathing very difficult. Symptoms can be, you can be coughing or wheezing or shortness of breath. Minor symptoms can be alleviated by having an inhaler or most of asthma people have this inhaler with them or very close by, and when an episode is starting to come up, they take a puff of this and that will help them with their breathing. But on a major scale, it could land them right into the emergency room, and in certain cases, death. So these symptoms can be brought on by triggers. Some common triggers are in the home include dust. That's a big one. The homes that I've been in, dust is always mentioned. That's one of the triggers. Mold is another big one. Pet dander. Most of us have pets. Secondhand smoking, dust mites, and volatile organic compounds. These are vapors that are gives off from cleaning products. Most of us have this stuff in our kitchen or in bathroom. There are others, but these are the common ones. So for the program itself, the enrollment, there's only two requirements, that you have to be a Minneapolis resident. You can be a tenant in a rental property, or you're a homeowner in Minneapolis. And you have a child that's under 21 with asthma. And in certain cases, if you live alone and you're under 21 and you have asthma, you qualify as well for this program. So for the program, there's two aspects of it. Again, if you're a resident, there's an education piece. You can go to this link and watch this 7-part video. It talks about asthma and triggers and medication and how to use these spacers for the inhalers and all that stuff. You take a pre-survey, watch the videos, take the post-surveys, and that will give you a $50 gift card And right now I'm giving out $50 Cub Foods gift cards. Your information will be fed into a spreadsheet that I monitor on a weekly basis, so that I can reach out to you and to deliver the gift card. So when I do reach out, I always ask them if they are interested in the second portion of the asthma program, and that's the mitigation program, which covers a trained housing specialist, in this case me. I will come out to your property and do a free home inspection, just to look for some common asthma triggers and discuss ways to reduce them. In some cases, asthma triggers are property-based. If properties are not well maintained, I have the authority to issue orders to the property owners to get that fixed. In the homes that I've been in, bathrooms, kitchens, and basements has more moisture problems than any other rooms in the home. So just a little bit briefly, in bathrooms, I could be doing a walkthrough and there could be a lack of caulking around the tubs, or the shower is a failed enclosure or something, water gets in. Kitchens, steam from cooking. If they have, a lot of the units have vent hoods on top, but they have to be working condition, and sometimes they have to vent outside for it to be effective. Most vent just circulates and then kind of blows it back into the unit. That doesn't help too much. And then in basements, sometimes I would see defective plumbing, or there's a crack in the foundation or something like that, and that leads to moisture as well. If they're corrected, no big deal. But if they're uncorrected, this moisture problem leads to mold, and mold is a very common asthma trigger. Mold loves moisture. You eliminate the moisture, or you cut that down, and your mold situation is handled. So when I do these home visits, I bring along with me a bunch of products to give out. I think of all the products that I give out, the one that I'm most proud of is a HEPA filter air purifier. This is a device that cleans the air. It removes dust particles in the air. They're made by a local company, Honeywell. You guys might heard of them. It's a wonderful product, and so I opened the box, put the machine together, installed the filters, and show people how to use it. It's very quiet and does a great job. And the obvious question that people ask all the time is, how long does the filters last, and how much does it cost to remove? Replace them. The good news is that they last a long time, somewhere between 6 to 8 months, and the machine will tell you when it's time to remove or replace these filters. And then the other good news is that they just call me, and I'll deliver some new filters for them when that time comes. Other products like a HEPA filter vacuum, I also give out. Vacuums, their job is to suck up dirt from carpets, stairs, other sources. But if they don't have a HEPA filter built in, the dirt that is sucked up also ends up in the air, kind of deal. And if you have an asthma kid, they're not going to do so well with all that extra dirt. So this filter captures that, and it goes right into the canister of the vacuum. Allergen pillow and mattress protectors is another product that I give, and that will help with the dust mites, another nasty asthma trigger. Dust mites are nasty critters. They're so small you can't really see them, but they're there. They're in your pillows, in your bed, So these covers will help with that. And I mentioned sometime I'm in the basement. If there's a major moisture problem, I would deliver them a dehumidifier as well. And mice droppings and cockroach droppings as well. I see that. That's another common asthma trigger. If I see that, I can hook them up with a pest control company that we work with, and they'll come out and abate the issue. And the best part is they'll send me the invoice, and I'll take care of it. These products and services is made possible by 3 funding sources right now for the program. The first one is the State Environmental Justice Cooperative Agreement Program. It's a long title, but it's a generous grant that we received from the EPA. We also have the Northern Meadows Settlement, and then the city's general fund as well. They all fund this program. And in the beginning, referral comes to me weekly from local medical providers. The list is right here. But more recently, they're coming in from the school nurses. I recently reached out to a few school nurses up on the north side and did a similar presentation like this with them. And so that kind of explains the referrals that are coming in. But actually, most of my referrals right now are coming in from word of mouth. People are experiencing my home visits, and then post their experience on their own Facebook accounts, and then their families and friends are contacting me as well. So that's really great. I think I said earlier in one of the slides that when I'm out on these home visits, if I see items that need to be corrected, I have the authority to issue these orders. But this is where the really cool thing is. We have money to give to owners so they can update their property. And that's a very amazing thing. You know, in my previous life as a code enforcer in reg services, we would go into homes, issues violation orders. That's nothing new. The orders are sent out to owners. Yes, there's a resource list that we also accompany with the letter, but it's not a guarantee. And so that they will get that funding or something like that. But this is it's a guarantee, and we're not talking about a couple $100 to buy some buckets of paint. These are thousands of dollars where you can swap out windows and stuff like that. That there's some really amazing work, and Lisa will talk about more about that, I'm sure, in her presentation about these grants. So this is the flyer that talks about our asthma program. This flyer I leave with the family after I do the walkthrough. It kind of states the program.
Hello.
Yeah, hello.
Oh, I'm sorry.
Oh, I'm okay. I thought there was a question there, but the number down below is a text number, 612-449 number. That is my own number. This is where I tell people, hey, when you're talking to your friends and neighbors, just send me a text. Just say something like, this is Joe Smith. I live at so-and-so address in Minneapolis. I have a kid with asthma. I'm interested in your program. Could you help me? And that's all you have to do. I take care of the rest. I call them and set it up. And so that's basically my program in a nutshell. I guess I'll be happy to take questions if there are any. And then I'll try to unshare my screen here. Let's see. Does anyone have any question? And then, and that's okay if you don't have anything right now. If you do have some in the future, my contact information is right there. You can contact me that way. There's one other ask that I have is that if you think that this program is useful and that other people will be benefit from hearing this, send it my way, and I would love to come and speak to them as well regarding this program.
Okay, my question, Vu, would be, now you mentioned about this asthma stuff and all that. I'm wondering because I have quite a few people who have lead in the windows. You know, there's these windows and then there's this lead that's in there, and people need replacement on their windows. How much of the cost is that going to cost the renter? Because I know that's expensive. If they have someone to come in there and do all this stuff, how much is the cost is going to cost the renter, not just the landlord?
I can go briefly into it, but I would probably leave it to Lisa to answer the rest. We have grants from HUD also that deals with leaded windows. The way we respond, we have a team of health inspectors that goes out and respond to what's called elevated lead level. If a child has been tested for lead, gone to the doctor's office, done blood work, that the result of that gets sent to the state's health department. If the blood level is at 5 microgram per deciliter, then that information is sent right to the city of Minneapolis, and then we would go out and do an investigation. We do a visual inspection. We took out our XRF machine, measure lead, confirms everything, and then we can enroll them. And it's based on the tenant's income, not the owner's. And that process, I don't believe that the tenant has to pay for anything. And so if that's your concern, it shouldn't be. But Lisa can address that if there's time after her presentation.
Thank you so much, Vu.
You bet.
Hi, Vu. This is Charlotte Kinsley with Minneapolis Public Schools. First of all, thank you. This has been super helpful. I'd love to get this out to our schools so they can access. So my first question is that already happening anywhere? Do you know, like through our nurses or anything? And then second, if you have some sort of flyer that I can access more directly that I could use.
Great question. I've reached out to, there's the Minneapolis Public Schools portal. If you want to have any take-home flyers from the schools, you gotta put a disclaimer in there saying, Minneapolis Public School does not endorse this, blah, blah. And then I did that, I submitted, and I haven't heard anything back from the school for months. And this was before the school started. So I figure, and then when the school started, it's, COVID and everything. Of course, they have other higher priorities than to respond to my flyer. But I can email you this flyer in a PDF form. If you want to help me distribute that, that's awesome. Like I said, I did do this presentation with 4 or 5 school nurses already. They were all on the north side. And so they have been spreading the word already. And so I'll be happy to send it to you also.
Great. And I'll put it in our social work newsletter and attach it there. Social workers can sometimes get stuff out a different way too. So I'll do that also.
Thank you very much. I was in a home a couple of weeks ago. One of the gals, she says that she was either the executive director of the McKinley neighborhood, or she's a board member or something like that. But she says she's going to post this flyer at their neighborhood meetings. And so that's great. And so if you can help me with the public schools, that'd be wonderful.
Will do. Thank you.
Yep.
Did Queen have another question before I start?
No, I don't. I don't have another question.
Okay,
Please
yeah,
stop.
your hand was still up, that's all.
Oh,
All right.
sorry, I'll lower it.
All right, so I'm Lisa Smestad. I'm the manager of the Lead Hazard Control and Healthy Homes program for the city of Minneapolis, and I'm going to be presenting today on the Lead Elimination Action Plan. This plan was requested by the previous city council. The goal is to stop using children as lead detectors and to address lead hazards before a child's poisoned. So why is lead paint bad? It's a heavy metal environmental poison. It causes permanent brain damage. It's mostly affecting children 5 and younger because their brains are developing. Even low exposures can cause a loss of up to 10 IQ points. It has lifelong repercussions like ADHD and learning problems, school. It affects the impulse part of the brain, which gets linked to people making bad decisions and having higher rates of incarceration and unintended pregnancies. There is no safe level of lead. You can see there is a social justice issue as to where lead poisoning is concentrated. So much of our housing was built before 1978, and 75% of lead poisonings occur in rental property in Minneapolis. It's kind of devastating when you look closely at some of the occurrences. We have had some blocks in Minneapolis where over the past 25 years, 30 children have been poisoned by their homes. And the sad fact is, you think, oh, what's wrong with that block? Those blocks aren't any different than some of the other blocks. It's just we've had good testing and we found the children at the right time. They got the blood lead test that identified what was happening so we could go in and fix those homes. So our goal, again, is to stop using children as lead detectors. If we did nothing, kept going kind of the way we are, we're not going to solve the problem until 2055. That's too long. That's too many more children being poisoned. We can shorten that timeline by putting resources into and changing business as to how we identify lead and correct those hazards. So the whole big thing is to switch from response to prevention. We're very good at responding once your child has been poisoned. We're going to visit the home. We're going to do a specialized cleaning. We're going to issue corrective orders. We're going to move the family out of the house for 5 days while those things are done. And the contractor must be licensed to do lead abatement to do it safely. We're moving to the prevention model that we're going to inspect the homes for lead during your routine rental licensing inspections. We're going to issue corrective orders. And then we're going to offer resources to the property owners, be they homeowner or rental, to make sure that we can get those hazards addressed before a child's poisoned. So the lead action plan is what was presented to the council, and I'm sorry, I'm having trouble getting my mouse to go where I want here to switch my slides for my notes. The city council has adopted this plan, and it has 6 strategies to reduce children's exposure to lead that focus on housing, and we're going to focus for this committee's presentation on the ones with housing. So we're working very hard with regulatory services to change how we do rental licensing inspection. So we have a program that we've piloted for a few years that now is being fully funded to have health department staff that are trained licensed lead risk assessors to go out with regulatory services staff during rental licensing and coordinated inspections to identify the lead hazards. It's still part of the normal routine rental licensing inspection, but we're just also going to have an additional inspector there that's going to be focusing on identifying the lead. So the downroad is it might take a little bit more time when we're out there doing the inspection. And you might, a rental property owner might get 2 sets of orders, one from the housing inspector, one from regulatory services on rental licensing things, and another specifically on lead. We also might do some portfolio inspections for property owners that have a history of repeatedly poisoning children, and we are engaging in a lot of cross-training of inspectors to make everybody aware of what these hazards look like. We hope to inspect over 500 properties in 2022 with this model, and have dedicated 5 staff to this program. And when we come out, we are also going to be, every time we hand an order to somebody, we're also going to be handing them information on resources. So the city is doing really good at identifying resources right now for the worst of to address the worst of these conditions in housing that are related to lead. There are HUD grants where we can spend, we can provide a typical house is $12,000 to make a unit lead safe. We can also put in $5,000 of unit into that property for healthy homes hazards. That's things like slip, trip, and fall hazards, handrails, radon mitigation systems. So we're bringing a lot of resources into these houses. Not only does the city of Minneapolis have a HUD hazard control grant for that, Hennepin County also has a lead hazard control grant. So when I say there's a $5 million grant that's going to be providing resources to city properties, double that and think there's also another $5 million that's available from Hennepin County that can come into the city and work on these resources. We also, the city has allocated some money from the American Rescue Plan Act resources, and so that makes the grant paperwork a little easier, because all your property has to do in order to qualify for those funds is it has to be located in one of these purple areas. And these will be providing, again, we'll be going in, we'll be looking for lead. We've identified over the years that the 3 things that poison children most are the windows, the windowsills, and the porch floor. So that's where we're going to focus these resources on, so that we can get that lead out of those properties before a child's poisoned. We don't know quite how much money the city is going to put into this program right now. I believe we have around $500,000. The city is still deciding how they want to allocate future money. So there might be more resources coming to address those. I'm sorry, my clicker there. We also were just awarded a HUD Healthy Homes grant. That's $2 million. It'll probably take us 2 to 3 months to bring this online. The advantage of this grant is it is not just focused on properties that have a child present. This grant also has a wider base, so it isn't linked just to children being there. And this grant is specifically designed to spend more money on addressing other home health housing hazards other than just lead. So we would use lead, the money in this grant, to stabilize lead paint, but we're going to be putting up to $10,000 in a property to do other healthy homes things like radon mitigation systems. We can do weatherization, we can do replace furnaces, make an upgraded, healthier furnace. We can do handrails. We can put in exhaust ventilation, which can really help address mold. We can address mold issues. And more than just ripping out the sheetrock and replacing it when there's mold in a property, we'll work with the property owner to identify the source of the moisture that's causing that mold to grow so that doesn't reoccur again. Some of the other elements of but those grant elements aren't always enough to address the hazards that we're seeing at properties. We need to get beyond just the grants. So we would like to work on establishing a revolving loan for lead paint or for lead service line replacements. If there's concerns about lead in the water at a property, we want to develop a process for voluntary assessment through the Hennepin County tax system, because sometimes property owners say, yeah, we'd love to work on this, but I don't have the money right now to put up that 10% match in order to make the project happen at my house. Well, if we can do a voluntary assessment, we can spread that funding out over a longer period of time so that we can get the properties made safe today. And we're also looking toward that assessment process so that we can order emergency cleanups. Like if I walk into a house and I see a windowsill like this and there's children there, I don't want to wait 3 to 4 months while I put together a grant package and go through all the enrollment. I want to be able to send a contractor out there within 2 weeks to get that lead hazard cleaned up so that a child who's living there is not going to be poisoned. Some of the So I talked a lot about resources, but sometimes you also need enforcement to back up the resources. So one of the things we're looking at is doing an ordinance for gross neglect. If you look at this windowsill, this didn't happen in a year. This didn't happen in 4 years. That windowsill probably hasn't been painted in 40 years. And to me, if a child's poisoned as a result of that, I think it's deserving of a fine for gross neglect. We also heard a lot when there were foreclosure crises about people lost a lot of information that they knew whether or not there was lead paint at a property. We'd like to explore having an ordinance where those risk assessment reports, that information about lead clearances can be put on file with the city so that we can never say we don't know whether there's lead at a property or not. If that information has been documented, we would like to have it and be the keepers of that so it keeps getting passed on, both for the property owner who's going to be buying that property next and for the residents or the tenants who are renting those properties. We would also like to explore having alligatoring, which this is an example of here, be included in the tier paint inspection. When it's a while between housing inspections, we think if the paint is starting to go into a dangerous condition, it should maybe be inspected more often instead of a 8-year thing. Maybe we need to be going back to that property and looking at that lead paint, every 3 to 4 years to make sure that it's being kept intact. Another thing that poisons children is bare soil at the foundations, because everybody throughout decades, when they were doing the maintenance on the outside of their house, they just scraped the paint and they let it fall right into the soil next to the foundation. The soil next to a foundation house is often in 10,000 parts per million lead in the soil, whereas out in the yard it's maybe 300 or less. So we can do a better job of focusing on the ordinances for bare soil around the foundations of the house, not the whole yard. Maybe I don't care if it's out by the tree, under the apple tree, where it's hard to get that grass to grow. That soil probably is not as contaminated as the soil that's right next to the foundation of house. So we're looking at targeting our ordinances and our enforcement to really identify the hazards and work on correcting them. We also think we can improve on the communications that happen between the landlord and the residents in the properties. There's a whole bunch of places we think there's an opportunity to increase awareness by providing education messages on lead, providing better information on the webs, providing workshops for either the property owner or their maintenance staff to attend to learn how to work safely when they're doing lead paint maintenance. We would like to kick off a call before you paint campaign, because painting can be paint maintenance, which we want to happen with lead paint, can also be one of the most hazardous activities that could poison a child. So call us. We're going to come out. We'll test that paint and we'll tell you whether it's lead or not, and guide you to resources that can show you how to do that maintenance safely. We offer free soil testing today. The water department should be kicking off later this year a free water testing program for all Minneapolis residents. And we're just looking to improve information on lead at every point that we can, that the city interacts with housing managers and either rental property owners or homeowners, so that we can end the children in Minneapolis being poisoned. Some other outreach that needs to happen is we would like to create a Lead Safe Parents group that will work with the children, because lead poisoning doesn't end when the housing hazards are corrected. We also need to engage the education system and to help parents know how to advocate for their children later in life, because of the issues that can arise from the lead being in their brain, and it affects their ability to be able to read, and it affects like ADHD is a common thing that can also happen as a result of the lead poisoning. We're going to be hosting workshops for tenant advocates, so they can know how to work with the tenants, so that they can advocate in order that properties are maintained well and free of lead paint hazards. And we're going to be providing some free training also to homeowners, so that they can maintain their homes in a lead safe manner. And we would like to increase our social media outreach and education on those hazards. A small part of our lead elimination plan is also to address different consumer products that we see in the stores that also have very high lead concentrations, and that have been linked to poisoning of children. By working with how people, these products are legal products, but maybe we can do better in how they're displayed, where they're displayed, and how, like if I have a lead pot, I want to sell that as a decorative pot. I don't want to see that being sold right inside the dish, right next to the dishes that I'm going to eat my food on, because if I put food in a lead terracotta pot like the one we see here, that lead is going to leach into the food and it's going to poison my family. And so a lot of this is just a matter of education and outreach and engaging with the community and the store owners who might not understand the ramifications of some of the products that are being sold. So again, the whole focus of this lead elimination plan is to stop using children as lead detectors. We have the science behind us. We know where to look. We know the age of the housing, and we're getting the resources to go and make those permanent solutions to correct lead hazards. And on the last slide here, this is our online application. We're also trying to do a universal application to make the online part very simple. We'll reach out to you and find out which grant is going to meet the needs of your property best. These are our grant managers, or you can reach out and contact me, and I'd be happy to answer any questions you have on lead or the resources we can have to help prevent lead poisoning at your properties. Are there any questions?
Yeah, Lisa, this is Scott. I have a question. Are there income limits for all these grant opportunities, or just some of them?
On the HUD grants, the resident in the home needs to be at less than 80% of area median income. And it's always good to ask if you're close, because sometimes the rules on how income is determined. You might think you're over and actually you do qualify. For the ARPA funding, that chart I showed in purple, there are no income limits as long as the property is inside of those purple, of that purple area.
Got it. Thank you.
And Queen, to answer the question you asked, none of this should require the tenants to pay anything in a rental property. A landlord might be asked to pay a 10% or a 20% match if we're doing multiple units in their property. But again, the homeowners, if their child's been poisoned, they're not paying anything. Do you have another question, Queen?
I do. I just want to make sure I'm clear when I hear this, that no cost is to roll over on the renter. No cost. No cost to replace windows, no cost to replace flooring, whatever that is strictly done out of the budget for that property with that landlord.
Yes, and if you have a landlord that is saying that they are charging you for anything, you should call us and we will work with you and legal aid, because that is not the intent of these programs at all, to put costs on a rental tenant.
Okay. All right.
I don't see any other questions, so I'm going to turn the meeting back. But if you think of a question later, we're happy to work with you and answer any questions.
Thank you so much, Lisa. That was great. That was great information. I think we're going to move on to Hennepin County Homeless with Danielle. Is that correct, Scott?
Yes, that's what I see.
Hello, everybody. So, my name is Danielle Werder. I'm the manager of the Office to End Homelessness in Hennepin County. The team that I work with manages our homeless to housing team, and our program manager is here today. We also have the coordinated entry team under us and our homeless response planners. So, hi, Green. We're here to just talk really briefly. We don't have a fancy PowerPoint. We don't have much. We just wanted to come chat and share some work we've been doing. We also had quite a bit of an allocation for our ARPA dollars, our American Rescue Plan funds. And so Katie just asked us to speak on two of those initiatives. So the first one we wanted to mention is what we're calling Streets to Housing. We just sent out a request for proposals that closed and we're in the review process. And the whole point of that is to put a brand new service out in our community and to be able to really engage with encampments as soon as they pop up, be able to know who's there, what they need, what services need to be brought to bear, what coordination needs to take place around belongings and closures, and be able to swiftly work towards housing outcomes with those folks. And be able to create infrastructure for the unsheltered part of our homeless response system so that we know exactly who's in encampments, that we can respond quickly to their needs and be able to organically close them based on housing everybody. So like I said, it's a brand new thing. We kind of put it out in the world for proposals and we're reviewing those now. We'll be excited once a provider is chosen and working with people with lived experience and community partners to get that put in place and up and running. And so that's coming, it's in the works, but what's already in place, what's already been launched is our Homeless to Housing program. This was us in Hennepin County taking our best practice that we stumbled upon in our Hotels to Housing project, where we successfully housed 437 people from the high-risk hotels, and 97% of those folks are still in housing. So
we figured that something's working and let's double down on what's working. And we created a permanent team and that we called Homeless to Housing. And that team just got started taking community referrals for housing, specifically housing case management, on November 15th. So they're a very, very, very brand new team. And I'll throw it over to Lynn to just kind of share a very general overview of how we get referrals and some exciting housing outcomes that we already have to date. Oh, you're muted, Lynn.
Thank you. Hi, everybody. So the program is new. It's basically comprised of 3 units of housing focused case managers. We have a long-term team, which focuses on people experiencing homelessness less than a year, or sorry, over a year, and a short-term team, which is under a year. And then the 3rd unit is the Homeless Access Unit, which maybe you're familiar with. They have been around for a while. But that team is comprised of social workers who have specialties they work on. For example, veteran specific. We have some specialties with the senior population, people coming out of facilities like jail and prison. That team will take the more complex cases typically, especially that fall into those specialties. So then we've got a referral form that anyone can fill out. It's online, and we get referrals from everywhere. Self-referrals from shelters, from neighbors who see someone in their neighborhood who they're concerned about, and we get those all into one mailbox, and the supervisors and I look through them and sort of do a little background, figure out which unit they would best be served by, and then assign it to a case manager from there. And the case manager works really quickly to bust barriers and to get people into housing. And then also at the end, we really make an effort to refer people to ongoing long-term case management services so that they can maintain their housing after we're kind of out working with the next person. It's kind of the 10-cent tour. Yep, we can put the referral in there. And I also have, I hope I can figure out how to do it. We also have the 1-pager that I will try to put in there too when I'm done talking. But that's kind of the program. And we just hit 55 people housed as of today. So we're pretty proud of that, given that we just started at November 15th. We're picking up speed. It was pretty unique in that we had so many new people starting at one time. So it was really a lot of training and a lot of sort of titrating their cases up to get to full capacity, and really seeing that we're picking up speed at this point.
That's perfect. Thank you, Lynn. We are thrilled by those housing outcomes, by the way, and we're ramping up to a goal of 19 human beings housed each week to meet a goal of 1,000 people who are experiencing literal homelessness housed each year, both sheltered and unsheltered. So we're really hoping to make an impact in our system. Happy to take questions. Like Lynn said, that's the 10-cent tour. We don't have PowerPoint for you, but we're hoping that that was good information for everybody.
And if I might very quickly just add, thank you, Danielle and Lynn, for being here to share that. Because this is the City Advisory Committee on Housing, just kind of the city's connection to this. So Danielle mentioned the RFP that just recently closed, and the where we're looking to find a provider to do intensive case management with people who are staying in encampments or outreach and case management. The city has some funding in that RFP. As well. And so it was a joint city-county RFP. And then we have a team of homeless response coordinators. And so one of the things that's relatively new team for us, and this team that Lynn and Danielle were just talking about is a relatively new team for the county. So one of the things we're doing too is just trying to make sure we're having ongoing conversations about how to best connect the work between our two teams, and so that so that our homeless response coordinators who are out in the field trying to make referrals to shelter and things like that for people staying in encampments also know how to access the case managers on the Hennepin County team. So just wanted to add that that piece to it. Thank you both for being here.
Of course. Thanks, Katie.
Thank you.
I have a question.
This is Charlotte with Minneapolis Public Schools. So first of all, thank you. That's super exciting work. My first question is, are you working with single adults, youth, families, anybody who gets referred, or is there sort of a defined eligibility around that?
Yeah, so as many of you know, there were no services in our single adult system prior to the pandemic. There was no case management. There was not the pieces that we need to connect hundreds of people passing through that system. So this team was very intentionally put into place to fill that gap. So it's 18 plus, and anybody who needs housing and who's literally homeless, so staying sheltered or unsheltered settings, and not already working with a housing case manager, because we want everybody to have access to a housing case manager. We don't believe we're extra special. We're just more. We're more bodies. We're more services. And so we just want to make sure we're not duplicating services and we're able to use all of our really limited case managers best we can. So youth, obviously under 18, no, but 18 plus, absolutely. The only piece is that we want to make sure they're not already connected to somebody that can help them get housing so we can use our services best we can.
Got it. And then, so my follow-up question is, I don't know the housing world as much. Like normally I'm working with families, so I'm looking at like 2, 3, 4 bedrooms, and like we can have amazing housing navigators, even with like vouchers, and we still can't find units for people. So I'm just curious if you're running into like the housing stock affordability issue, or really is it more just like getting people the services that they need? I'm just kind of wondering about that intersection of like what's possible within what we have.
You know what, before hotels to housing, I think we would have had a very different answer. But what we've found with hotels to housing is that if you're really resourcing those case managers and you're working to break down all of those barriers, that everybody is housable and it's just doable and it's out there, and the resources, it's really about building this package that people can move into. Obviously it's harder for some and it takes a lot longer for some, but there's folks that were in shelter for years and years and years that we were able to house out of those hotels for a lot of different reasons, right? They were in a different space. They were able, it was 24/7, they were able to focus, but we also believe that this connection to case management and being able to have them build their goals with the case manager, that we were able to find housing that maybe we didn't know that person needed or looked for, and so we were able to use some different resources. I'll also say that we had a wonderful partnership with Minneapolis Public Housing. As you know, the folks that were moved into those high-risk hotels were seniors and medically vulnerable individuals, as it was an intervention for COVID-19 when it was first unfolding. So we had a lot of seniors in these hotels. And public housing prioritizes literally homeless seniors for their site-based units. And they had a bunch of vacancies. So it was just that one of those moments of like, all these people were sitting in shelters, all these units were sitting open, let's get this going. So we had over 150 of our hotels to housing folks move into site-based public housing. So there's pieces like that where even if you don't think it's all out there, we had a specific population that had a really specific intervention that just wasn't getting utilized enough, and we were able to dig into that. That all being said, of course, we need more housing. Of course, we need more affordable housing. We need all of it, right? And we're able to use really thoughtful case management to try and make all of this work. That being said, Lynn is our expert. Lynn, do you have anything to add to that?
I do not, but I did just send out the referral form, the 1-pager, and the eligibility tree to Joey to pass on. Sorry, I couldn't figure out how to put those in there. I don't have the little paper clip.
Thank you very much.
Okay.
Great work.
Thanks, Charlotte.
Thank you.
All right, So I'm not going to take up a lot of time, but I do have a couple questions. One is, I work with a lot of different agencies out here. I have an agency myself, and I'm working with a lot of people. I was able to call a case manager from Hennepin County because I had a guy who had gotten frostbite. And it was because he was staying in the tents and he didn't have a propane heater so to keep himself warm. So unfortunately, he got frostbite on his feet, and we just hope that they don't have to amputate. So with that being said, I wanted to know, in trying to house people like this, is it that GRH will come in? Is it that there's some type of rent voucher that they can apply for? Do they have to go access the ACT team or coordinated entry? I'm a little bit versed in understanding some of the process, but I have people that need to be put somewhere, and they don't always have enough money to cover a $1,650 rent, or for an efficiency, or $1,100 rent for a 1 bedroom. So I'm wondering if there is some resource for that, and also if is there a program or something where if I can get something that is co-housing for them, where I could have them and the person that, unfortunately, that person that had gotten frostbitten also was supposed to receive like a caddy or something, but he said that there's a waiting list or some kind of other thing that's going on. And the person that shared the tent with him has congested heart failure. So I'm really trying to see, based on those medical needs, if there is something out there that could get these people co-housed just to get them up out of that tent. And I was able to use some services from Hennepin County. So I thank both of you all for being on this right here. It does help me out a lot, but I just don't have some questions answered. Thank you.
Right on. Thank you, Queen. So the first answer to your question is all of the above, right? All of those resources are all the things we look at. We're hustling just like everybody else out there trying to house people, right? And so what we do is we approach it from a very person-centered perspective. So if a person is starting with several felonies, recent felonies on their background, and several misdemeanors and a UD, that's going to be a very different housing goal plan than somebody who has no housing barriers, nothing on their criminal background, nothing on their housing background, and an income, right? So we really approach it from each individual. What are their housing barriers? How can we systematically break them down? It is important to have this robust, well-trained case management team that we've been able to put online, because we're able to have these specialists in our team that know how to tap into different housing programs and exchange resources through our case consults. We're able to break down barriers based on the program that we created. So if somebody has a unlawful detainer and that is the only thing keeping them out of housing, let's talk about that. Let's find a landlord that'll rent to them and let's pay down that debt. So I think part of what you're up against is what most people are up against, that you need to be pretty well coordinated and well resourced to figure out how to navigate this complicated system for people. I'll also say we have many clients that are unsheltered. We know that there are many different reasons why people don't or can't access single adult shelter. That being said, we firmly believe that it is safer, always going to be safer for people to be inside than outside, for all the reasons you just explained, Queen, especially around physical frostbite and everything else like that. So we maintain everybody, if somebody is willing or able to think about shelter, talk about shelter, we have a shelter amenity sheet that really goes through every single shelter program, what they offer, so that people really can opt into shelter programs and may be able to serve them better. Private rooms, 3 meals a day, 24 hours storage. So shelter is always a resource that we are pushing and supporting, and we believe that it's safer. That being said, we know that folks are unsheltered and aren't able to go into shelter for many different reasons. And so it's really how can we very quickly identify your housing barriers? How can we work together to break them down as a case management and person team? And how can we wrap those services? The CADI waiver you explained, an arms worker, housing stabilization services. How can we connect that person to ongoing support services right away while we're working on the housing so that they know them, they're comfortable with them, and they can maintain that housing moving forward? So I hope that answered some of your questions, Queen. But honestly, some of these folks, I hope that you send a referral form in so that we're able to send somebody from our team to go work with them if needed.
Thank you so much, Danielle.
Of course, thank you.
Is there anything else, Scott?
This is Bruce. I have a comment for Danielle and Lynn. I'm just going to echo a comment from earlier. I think it was Charlotte that mentioned there's often difficulty for families, and part of the problem is MPHA has decided to only reimburse at 95% of fair market value for 3 and 4 bedroom units, and they reimburse at 100% for 1 and 2 bedrooms. So if as you're having conversations with MPHA, if you can urge them to bring that up to 100%, that makes the difference between a lot of people who own rental property being able to put it into a program and not, because it's about $100 a month. And for a lot of properties, they're already taking $100 to $150 hit just to be in programs to accept Section 8. And it can get closer to make a difference for families because there's just not enough places that can handle families with 5, 6, 7 people. So thank you.
Thank you for that recommendation, Bruce. We'll definitely keep that in mind and bring it up.
Thanks. It looks like Katie has a announcement.
Yes, and this is on a new topic. So it sounds like we've wrapped up that discussion. So thank you again, Danielle and Lynn, for being here. Really appreciate your time. So yes, I just wanted to share that our longtime co-chair and committee member, Colleen Ebinger, if this is her last meeting for our committee. Colleen has been on the committee since it started back in 2019 and was our co-chair for the first 3 years. And so Colleen, I just wanted to thank you for all your time and commitment to the committee, and wish you well on your new adventures. And I don't know if you want to say anything, but just wanted to make sure we acknowledged that and thanked you for your service to the committee before we closed today.
Thank you, Katie. I appreciate that. And thanks to everyone. It's been an honor to serve on this committee. And I think that, in the first 3 years as a new committee, it took really this whole group trying to figure out what we're supposed to do and what our role was going to be. And I think that the group really came together to figure that out. And I've really appreciated the relationships with every single one of you. So thank you to everyone.
Thank you, Colleen. You worked really, really hard for this committee, and it's made a really big difference.
Yeah, I'll just add my thanks, having the privilege to be co-chair with Colleen when I was at Legal Aid. So for our first 3 years, just really enjoyed working with you, and you contributed so much to kind of the structure and getting this committee to where it is today. So thanks, and wishing you all the best as you move forward.
Thank you, Colleen.
Thank you, Queen, and thanks both Queen and Scott for stepping up into your leadership roles. So.
Yeah, thanks for trying to fill your shoes. I think that is an issue that we'll be visiting in a future meeting as more vacancies are filled on this committee, having a process for bringing more people onto the leadership team if they'd like to.
I just have one sort of logistical thing too to add, if that's okay, Scott and Queen. If folks are tracking it all, so the city of Minneapolis is starting to move kind of toward more of a hybrid work kind of plan starting next week, but that is not going to affect this committee for the time being, as things are rolling back toward more in person. As long as they keep moving that way, they'll be starting with city council and city council committees, and then these sort of advisory boards will be later and to be phased into any sort of in person. So I think we can pretty confidently for now say that our plan on our March meeting being virtual. Of course, we'll let you know if that changes, but I think we have pretty high confidence that we won't be back in person for these boards by March. So just wanted to throw that out there in case anyone's hearing word on the street about the city going to a hybrid model.
So I want to, oh, we're almost out of time, Scott. Look at that. The clock on the wall is ticking and it's saying that's about all. But I also want to just briefly put out there, now, is this hybrid mean that some things will be in person and some things will be virtual, or that's what I'm thinking that I'm hearing here. Some things will be virtual and some things will be in person. Is that about
Katie,
right?
do you maybe want to talk a little bit about?
Yeah, it's really just for city staff, we're starting
okay.
going into sort of a hybrid work model starting next week. But all the public meetings, at least for now, the council meetings are going to remain virtual for now, and advisory boards and commissions. And so at some point, we assume things will start to be in person again, but it's going to take the clerk's office some time to figure out what that transition looks like. And so I think what Joey was saying is that once it'll be the council that starts meeting in person first before any advisory boards and commissions do. So we expect this group to stay virtual for a little bit still. So the hybrid thing is really about just city staff are going to be coming into the workplace at least part-time. Many city staff. I don't know if it's across the board.
That brings me to a second question. So there are other people that I know that BIPOC community that would like to get engaged with these boards, housing, whatever engagement, community engagement boards, what have you. And I would really like to know how I can help with getting them on boards or on advisory committees or what have you. Can you give me tell me.
Yeah, I can speak a little bit to that. So there is, I can send out the link in an email when I send out the Hennepin County's materials, but there is a place online that shows any open board and commission spots. I think there might be a few posted there right now, but the clerk's office is moving to really having kind of a spring recruitment drive, so to speak, and a fall recruitment drive to kind of consolidate when these openings are put out there to the public. So for that reason, so that they don't just kind of fly under the radar, so people know kind of when to expect them and when they're happening. So from a recent meeting, my understanding is that starting in about March, is when they'll sort of open up a big kind of chunk of different boards, advisory boards and commissions that have openings for the public to apply for. And so you can always reach out to me, but I can also we'll make sure, just as a matter of course, that we'll circulate that information with our March meeting materials. Because there will be vacancies for this committee to fill. Some of them are designated for certain kind of roles or people with certain experience, but then there's going to be other, as you know, plenty of other advisory boards and commissions that will be looking for members as well. So thanks for bringing that up.
All right, and so the recruitment would start in March, and then they aim to bring some members on in April or May or something. Is that the plan, you think? Okay.
Yeah, it would look something like that. I don't have a perfect timeline, but with applications being open in March, maybe into early April, and then going through kind of the more administrative process of getting those formalized.
All right. That sounds good. All right, so I see 4:56 on my clock. Are there any other announcements or any other discussion items from the committee members? All right, I don't hear anything. So do you want to do the honors, Queen, or should I?
What are we saying? This meeting is now adjourned?
Yeah, and the next one is going to be on March 10th at 3 p.m., right?
Yes.
I
Yep,
forget.
March
Do
10th.
we do a roll call for adjournments, or do we just say just hang up?
Goodbye.
All right, thanks
This
everyone.
isn't the Carol Burnett show, but goodbye. We appreciate you all. We'll see you next month, right here. Same bad time, same bad channel. Love ya. Be safe.
Thanks, everyone.
Thank you.